Hey everybody, welcome to Barbour Orthopaedics. Today we got a great show with a patient of ours, Brad Hodgson. He's also one of the employees at Barbour Orthopaedics. He just had a knee replacement 2 weeks ago, and he's going to share with us his experiences during the whole process to give you guys some insight into what it's like to get a total knee replacement. How you doing, Brad?
I'm doing excellent.
So, Brad, he's a very athletic guy, and he's a relatively young guy for the world of knee replacement. But nowadays, the equipment in knee replacements is so effective that younger and younger people with damaged knees really get tremendous benefit out of it. It allows them to get back to activities like playing basketball or tennis or golf, and it dramatically improves pain. Now, Brad had athletic injuries over the years and other injuries that damaged his left knee. And you've been dealing with arthritis in that knee for a long time. I've known you for 10 years or more, and your knee's been problematic the entire time. Why don't you tell us a little bit about that?
So my first knee injury actually occurred when I was 14. I dislocated my knee playing football. The doctor that originally reconstructed my knee said I would be lucky if I could walk without a limp. And when they completed my surgery as a 14-year-old, they told me I would most likely need a knee replacement in my 20s.
Wow.
I was able to continue playing sports all the way through college. I was running and active, and then I had another injury that was basically like a light switch.
Yeah.
It made it to where I couldn't bear weight on the leg anymore. It was unstable. Couldn't play with my daughter anymore, couldn't run around in the backyard.
I'll often have patients ask me, when am I supposed to get my knee replacement? And my job is to provide you with the option. It's the patient who tells the doctor, I'm ready for the knee replacement, because that's what we're really trying to do is restore quality of life, restore function, and obviously get rid of your pain. 42 years old, he's got an end-stage degenerative knee. I mean, radiographically, the x-rays of his knee really showed severe damage. I looked at it and I was shocked that he lasted as long as you did. So anyway, you called me and you said, I'm ready to do the knee replacement. You're a great candidate for an outpatient total knee. So we got you set up 2 weeks ago. So we're at 2 weeks and 1 day from your knee surgery. We did your knee surgery. Why don't you talk about the experience getting ready for it and the day of surgery?
A lot of it was wrapping my head around, I'm actually going to do this. I've thought about it for a long time and weighing what I thought the pain was going to be after surgery, comparing it to what I felt during a normal day. Probably up until about the week before surgery, I was still having thoughts, well, maybe I can deal with this. Maybe I don't need it yet. But before surgery, every step I took, it literally felt like somebody was taking a knife and shoving it into the center of my joint. Every step.
You have a lot more perspective than most people. I mean, you've been in the operating room operating on total knees. You've seen patients going through total knees for decades now.
Yes.
What was going through your mind when you're the person considering knee replacement?
My biggest fear was waking up with more pain than I had, or not being able to get around the house, not being able to function. I'm very independent. I don't like to let people help me. And I didn't want to be a burden on the family, not being able to get around the house, not being able to help with my daughter in schoolwork, and just laying there on the couch debilitated. I didn't want to be that person.
So those are kind of the big points that a lot of people make, and they're important. And that's one of the things I want to share with people today is the amount of pain that you have is the biggest fear I usually hear from patients. They're really afraid of, this is going to be a painful procedure and being laid up for long periods of time. But you're 2 weeks out, 2 weeks and 1 day, you're driving a car.
Correct.
So you came, and you're at work today.
Yes.
So that's amazing. The other thing I would say is, we were talking about this earlier, on a 0 to 10 pain scale, what would you say your level of pain was before surgery? So your arthritic knee on a day-to-day basis.
Every step, that knife pain, that was a 7 out of 10. And there were some times when it was worse. If I'd sit in a chair for too long and forget to straighten my leg before I extended it, it would lock. And I would get up to these sharp, stabbing 10 out of 10s, and the people sitting across the table from me at work would look and they're, are you okay? because it would just make my face go white. The
Yeah.
pain was that bad.
On the day of surgery, we gave you a block, and then of course we do our secret cocktail during surgery, and you woke up. How much pain did you have?
I had no pain when I woke
So
up.
0 pain. Now, we actually have a video of you out online that we put on social media and things like that, and I noticed that some people were commenting things like, well, you just wait till the block wears off, and things like this, and I thought to myself, okay, so we had 0 pain with the block, which is pretty typical of most of our patients with total knees. When did that 0 pain wear off?
The block itself wore off around 9 o'clock at night. That's when I started to feel some pain. But
So this is somewhere between 16 and 24 hours after surgery, the block started wearing off.
correct.
And you started to feel some pain, and describe that to us.
So when I got home, the first thing that my wife did was she gave me the first dose of medicine. My surgery is 8 o'clock. I was at my house by 1:30. When I got home, instead of just sitting down and just kind of relaxing, I took my first dose of medicine.
Which is what we counsel all of our patients,
Correct.
so that we know that they have some pain medicine on board for when the block wears off.
Exactly. So sat down, I put on my ice machine right away because I'd ridden in the car for 45 minutes. I wanted to cool it down. I wanted to push any swelling that had occurred out of the knee. And then I got into my CPM machine and just started just gentle. I didn't try to go crazy with it. I couldn't feel the knee. I didn't have any pain, but I also knew that the block was there.
Yeah.
And so just gently, just moving it back and forth to keep it loose. And then like I said, I started to feel pain around 9 o'clock at night.
And what level of intensity was? So you had 7 out of 10 up to 10 out of 10 before surgery. What was this pain that you started experiencing at 9 o'clock at night? What level would you say that was?
A 2 or a 3.
You are one of these people, you just weren't really taking any significant pain medicine. You took a little bit of Ultram, a mild narcotic. So you weren't even using the maximum level of pain medicine that we have available for patients, because you felt like your knee replacement or your knee pain was manageable and that you didn't need anything else?
Correct. I mean, it was so much less than before surgery
Yeah.
that once I got to the point where I could put weight on the leg without having pain, the rest of it was manageable.
You had a 7 to 10 out of 10 intensity pain before surgery. We did surgery, you had no pain immediately after surgery, and for about somewhere between 16 and 24 hours later. Your pain level got up to a 2 or 3, and then at its worst, 3 days later, it was a 4. And you were telling me that was easily manageable with some oral Ultram.
And ibuprofen.
Okay. And now we're 2 weeks and a day out. What's your pain level?
I'm maybe a 2. And that's when I drove down here today. It was flexed in the car for a 45-minute period. When I got out and I had to straighten the knee, I was like, ugh, that's achy a little bit. But it wasn't pain.
Yeah.
It's an ache now.
Yeah.
And it's that kind of, I associate it with healing pain.
Yeah.
The soft tissues, it's more of a global pain. It's not a focal inside of my knee pain anymore.
So to me, that's really good information, is at no time during the course of your recovery, and in terms of pain and things like that, the worst is far behind us.
Correct.
Did you ever have pain that was worse than what you went to sleep with?
No, never.
And I mean, I think that's important for people to know, that this is possible. Now, the other thing is, you're an athletic guy and a fit guy. You know, your mindset is that of somebody who exercises. I mean, you train, you work out, and all that kind of stuff. Have you just been laying around the house?
I get up earlier than what I normally would for work. The first thing I do is I put my ice on the knee just to kind of calm it down a little bit when I wake up. Then I stretch. I actually get up and I stretch. Then I get dressed, I get to work, and I come to work.
A knee replacement's not a passive thing. You know, you can put it in and it's perfect, but that's just the beginning. It's the exercises and the protocol that you need to do to appropriately rehabilitate it that gives you the fantastic result that you're having. And that's what we do, is try and educate our patients and stay on top of our patients and encourage our patients to, and equip our patients to be able to participate in this daily physical therapy program to give them an optimal result.
After stretching, I have full extension.
So you're able to get it all the way straight, which is important.
All the way straight. And passively, I can get up to 100 degrees of flexion. Actively, I'm around an 85.
That's fairly typical. Would you mind showing your knee so we can kind of see the comparison of the swelling? So there's no stitches. We glued the wound closed. I would say that swelling is very good swelling for a 2-week knee. I always tell my patients that within 2 weeks, you'll be happier with your new knee, your knee replacement, than you were with the arthritic knee that you came to us with. People are usually about 80% recovered at 12 weeks. And then as good as you're ever going to get in terms of strength and range of motion and all the rest of it takes about a year. So you're really at the beginning, and just overall, how would you rate the experience?
So there's part of me that wishes I would have done it a long time ago.
It's a very common statement.
Yeah, before I let the muscle atrophy in the leg. I mean, it's crazy. Even my ankle is not liking me now because with it having
We got
bared
your
weight.
alignment
Yes,
better.
now that my alignment is good, my other joints are saying, hey, what's going on?
You had a pretty bad, what we call valgus deformity, so your leg was sticking out at like 20 degrees, so you've kind of been walking on the inside of your foot for a couple decades. Now your alignment, what we call your mechanical access, has been restored, and it's going to take a while for your brain to get used to it, and that's kind of part of the recovery process.
The pain that I expected to have wasn't there. I mean, that was my biggest deterrent to proceeding. Was I was just afraid that I would not be able to function. I wouldn't be able to get back to work. Everybody knows me, and they know I'm a workaholic, and I hate staying home. I will go crazy.
Yeah.
And, you know, when you said, we can do this, you're going to be fine, you maybe need to miss a week of work, and then you'll be back. As soon as you can be off your drugs and drive, you can go to work. I mean, that was what pushed me over the edge. I was just like, it's time. Let's get my life back.
So what would you just say to people that are considering knee replacement?
Don't wait until you're miserable to do it. You'll know when it's time. Your life will be changed once you have it done.
What are your feelings about doing it as an outpatient? I mean, as a surgeon, I've always kind of known that most people are actually better off as an outpatient because you're in your own house, it's more comfortable. You know, you can you're in control of things.
That
a
was
lot more.
exactly it. Being in a comfortable setting for me, being able to sleep in my own bed if I wanted to, you know, knowing where everything is, being able to get everything for myself.
Being able to get your pain medicine when you want it, as opposed to pressing a button and having a nurse come by at some point.
Not having nurses come in and wake me up every 2 hours to do neuro checks and then being so tired the next day when they try and drag you out of bed to do therapy.
Yeah.
I mean, you and I have seen that for years. We come in day 2 and the patients are just dead tired because they wake them up all the time.
You know, nowadays, the knee replacement that we use has been FDA approved for 30 years, and I believe the company tested it to beyond 50 years. So these knee replacements are not your parents' knee replacements that would wear out in a few years. They're a lot more robust, and you know, obviously, anybody who has a knee replacement or an artificial joint of any kind, the more you use it, the faster it's going to wear out. But there's a responsible way to do this so that people can get back to jogging and playing tennis and basketball and golf and skiing and things of that nature. And that's really the whole point, is to sort of give you your life back and allow you to keep doing the things that you like to do and that you need to do. Brad, I really appreciate you taking the time to share your experience with us.
Yeah. This has been excellent. Thank you.
Awesome. You bet. We'll see you next time at Barbour Orthopaedics.